breaking news, the Centers for Disease Control just releasing a grim prediction for Ebola, forecasting up to 1.4 million cases of the deadly virus by next January in Liberia and Sierra Leone, if efforts to continue to contain it are unsuccessful. Joining me now is Dr. John Noseworthy, CEO of the Mayo Clinic. Welcome. Thanks for being here this morning. Dr. Noseworthy, what do we need to know about Ebola as it is a threat right now?
Ebola is a very infectious virus, not as contagious as some because it's not spread by airborne contact, only by contact with liquids from the patients, but it's very infectious. So one virus, one particle of virus can cause a lethal infection. Almost 50% of the people who get infected with the virus will die of it in spite of our best efforts to save them. So it's a big problem. Over the last 6 months, it's spreading through West Africa, and efforts to contain it are working in Senegal and Nigeria, but not so much where it's really hitting hard in Liberia and Sierra Leone and Guinea. So it's important that this global effort to contain Ebola is successful.
Are we gaining more knowledge by the day about how to contain this? And is that knowledge getting to those countries that need it the most?
Yes and yes, but this requires a very disciplined effort to protect the healthcare workers and the citizens, and fear has taken over in some of these countries, which has contributed to the human suffering and candidly is contributing to the financial implications for these very impoverished nations.
Now, to this day, I still, in the airports, you still hear people talking about they're fearful that somebody's going to get on a plane from one of these countries and they're going to somehow spread it to passengers on that plane. And then people who aren't even flying or here at home are worried about sitting next to somebody on the subway that just got off of one of those planes. Is that still a real threat to have Ebola spread here in the United States?
It's a possibility that it could come to the United States, so preparedness for the public and for hospitals is terribly important, and we're very active.
Do you feel that our hospitals are ready?
I think they're getting ready around the country. They know they need to because, and that's what the healthcare organizations in this country need to do. Inform the public, don't frighten the public, but inform the public so when a patient comes to the emergency room, they see posters, they're aware that if they've been in Africa recently and they have any of the symptoms of Ebola, they should report right away. We have to isolate those potential patients so they don't contaminate others. There's research going on in this country and North America, other places to try to...
What's Mayo Clinic specifically doing?
We're involved with an oral vaccine program to try to create a vaccine for Ebola. We're not ready with that. We're involved at the national level with education and preparedness, but we haven't sent anyone over to...
Has this whole thing taken you by surprise?
Well, we've known about Ebola now for almost 40 years. Usually there are small pockets of it that are contained. This is a public health emergency at a global scale, and so it has to be taken seriously.